Awaiting a Category 3 hurricane. It'll be hitting Tampa tomorrow or maybe late tonight. Anyway, this is our pre-hurricane party, and this is our last pre-hurricane patient, and we're going to be doing L4-5 and L5-S1 Deuk laser disc repair. So while the rest of the world watches Florida get battered by a Hurricane Ian, we're going to be operating right up to the last minute. I'm just kidding. We've got till tomorrow afternoon around this time before the hurricane gets here. So we've got a good 24 hours to go. My opinion.
Do I get to keep the glass?
Huh?
Do I get to keep the glass? Oh.
Do you get to keep the glass, Sean? All right, let's get some more num-num. So I'm going to have to put some more numbing medicine a little bit further north. Now, what kind of glass are you talking about? The shot glass?
No, the hurricane glass.
Oh, hurricane glass. Do you have hurricane glass at your house?
No, but there's a lot of them in New Orleans.
I see. All right, we gave some more numbing medicine. So the first part of the surgery is really to get from the outside world where we are down to the disc that we need to fix. Just relax, you're doing fantastic. And you can see that Jordan has done an exemplary job of lining up the machine with the L5-S1 disc. I need to get down there so I can fix it. You're fine, just relax, you're doing great. We're just making our way down to that bottom disc. Sean, I can feel the arthritis. Everything's good. Sean, I'm going around the facets. Sean, this is the worst part of the surgery, by the way. Did you watch any of these surgeries? You watched a few? Well, what'd you think when you were watching them?
Amazing.
Huh?
He was amazing. Amazing.
Yeah, it's pretty amazing. Sean? Well, Sean? Huh?
The father son that had both had surgery with the father had his twins.
Do you remember what's the hardest disc to fix in the lower back? You are 100% correct. You're a good student. You've been paying attention. And I want to applaud you for knowing that. L5-S1 is the hardest to get to. And this is exactly why. Because it's at an angle and it's really low and the iliac crest blocks. But you know what? I got great news for you, my friend. We are there. We are at the hardest disc to get to. Sean? Just about done with it, too. This is the most collapsed disc you've got, by the way. You already know that, though, right? Mm-hmm. We're in, like Flynn. Okay? Thank you for helping me. That was a tough one. I didn't know if we were going to be able to get in, but you made it happen. Helping me out, okay? You are welcome, sir. It's my pleasure. I love fixing people like you and getting you out of pain. All right, so I'll give you a little bit of numbing medicine, okay? Just to make it feel a little more comfortable. You might feel a little pressure. That's just the medicine going in, okay? Just lay still. Huh? Yeah, you are. I can tell. Isn't it amazing, though, no matter how tough you are, this disc pain is so difficult to deal with, isn't it?
Put you right on your knees.
I heard him. Puts him on his knees. Yeah. Trust me, I get it. That's why I've dedicated my entire career to fixing people like you.
I am humble.
Almost done, by the way. We're going to be able to put you to sleep soon. And then when you wake up, we'll be done with your surgery. Sound good?
Thank you. I get that.
All right. So I'm just jockeying down through the foramen right to that L4-5 disc. And I'm using a feature of the needle, which is the beveled surface, to navigate right past the facet joint. Now, where do you live?
These days, nothing's getting,
Oh, right. Okay. You're a Florida boy.
no,
Not originally.
no.
But aren't you in Florida now?
Born
Perfect. How long have you had back pain for?
virtually and,
How many years? Just give me a number. It doesn't have to be exact, but roughly how many years have you had back pain? No.
40 years.
4 years. So for 4 years. It's been bad for 4 years?
no, 4,
40 years.
40.
I'm sorry. Just lay still. We're almost done.
I didn't find you earlier.
You what?
I did not find you earlier.
I understand. Most people don't, unfortunately, but we're going to change that. This gentleman, folks, has had back pain for 40 years. And what bothers you more, the back or your legs?
Absolutely, positively,
The lower back. What percentage of your pain is back pain versus leg pain?
almost negligible,
Huh?
almost negligible,
Give me the percentage that's back pain.
90%.
90-10. So 90% of his pain is back. You guys getting this? And then 10% is legs. Okay? So, common typical patient that we get. What's causing the back pain, folks? I believe it's his discs, the L4-5 and the L5-S1. So he's got 2 discs. The L4-5 looks pretty good on the MRI, but there is a tear. And then the L5-S1 is totally flattened out, degenerated. So if you want to compare, L5-S1 totally degenerated and collapsed, no problem, we're still going to fix it. And then the L4-5 is a pretty nice, well-preserved height, disc height. Okay? Are you comfortable?
Pretty darn good.
Yeah? All right. No pain?
None at all.
Great. What happens next in the surgery? Do you remember? All right. Don't worry. We've given you some medicine. Harder. How much pain is that on a scale of 1 to 10? You feel it?
Yeah, I am.
What's the highest it went?
6.
6. He's pretty tough. Didn't go higher than a 6?
No, sir.
All right. Is that where you typically get your back pain?
Yes.
So it's concordant. 6/10 concordant. Did you take any pain medicine today? Negative Ghost Rider? Is it better? You don't feel it anymore, right? All right, you can see on the lateral x-ray, Jordan, show them the big tear in the back of the disc at L4-5 and then show them part of the herniation. Just take a look at this x-ray, folks. Can you see this, Henry?
Yep.
All right, big tear, circle the tear. Yep, that's all tear there. And that's nuclear material in there. That's the herniation in the foramen. Not a big herniation, not by any means at all. You better?
So far, so good.
All right, good. How bad is that on a scale of 1 to 10?
Well, that's an 8.
8. That's the highest it went?
Yes, sir.
All right. Is that where you typically get back pain? Is that the area that you typically get back pain?
Indubitably.
Yes.
All right, I got some good news for you. You get to count from 1 to 100. When you wake up, that pain will be gone for the rest of your life. As long as you don't re-injure it. Give me a count out loud. What?
You want to start with
Yeah, why not? Right? What do you want to do?
It's kind of collapsing.
It's all right.
It's okay.
You want to do 4 or 5 first?
Yeah, can we do slow deep breath, buddy? It's okay. It's okay.
A little bit, yeah.
All right.
You're doing great. He's just not moving much, so I think we're going to be okay. Right?
Should be fine.
We're going to start with L5-S1. Luis and I are just having that conversation. So folks, what we've learned so far is that the patient, when I saw him in the clinic, I said, "Where is your back pain?" And I said, "Point to the worst spot." And he pointed to this area right here. Okay, well, what's here? You got 2 discs, L4-5, L5-S1. So we just tested them and we confirmed that they are indeed causing his typical back pain. Now, he's a pretty tough guy. He didn't really move much during the discogram, but you could tell it was really hurting him. He tensed up and he made some noises, some grunts. So we know that the L4-5 and L5-S1 are the cause of his pain. The L5-S1 was more painful. You could see him respond more. He was tightening up and moving his body, whereas he didn't really do that for the L4-5. The L5-S1 was an 8 out of 10. This is an 8 out of 10 right here, but the L4-5 itself, this was a 6 out of 10, 8 out of 10. Both concordant. Are you comfy? All right, we're going to bring the dilator down. It's passing through the muscle, and it's not hurting the muscle at all. It's just splitting it open and spreading it apart. We're at the back of that L5-S1 disc right now. I'm going to pull the guide wire back just a little bit. Shot. A little bit more. And now we're going to... Remember, the guide wire and the needle were used to help us get to this spot right here safely without damaging anything. Now we have to advance the dilator in. He's responding a little bit.
Just get him over the BP max.
Yep. Well, you want me to wait?
Just let the meds kick in for the BP. His BP just went up.
I'm going to try to give a little more numbing medicine. See if that helps too. You could actually see the blue dye from inside the disc already coming out. So we know we've started entering the disc with the dilator. Give him a little more numbing medicine. See if that helps. The most painful part of that disc is going to be the outside where the tear is, and that's right where we are right now. We're entering the tear. So people ask me, when you go into the disc, don't you cause damage? The answer is no. The damage is already there. We're just going through the damaged part. That's the beauty of this surgery. Wait still or keep going? I think Luis was right. He's giving me the evil eye.
Oh, it's fine.
Let's just wait a minute. Let's try to get him a little deeper maybe, or more comfortable. I want to make sure we're in the right spot. Everything okay, doctor? Luis, let's take the guide wire out. All right, we are in 5-1 nicely, and I could feel it go in. We're right through the tear in the back of the disc where all the pain comes from. That's why he's not happy right now. Believe it or not, if we were not in that painful disc, he wouldn't be moving. The fact that he's moving tells us we're in the right spot. Shot? Shot? Should be good. All right, so we're inside his degenerated disc. There's no nucleus left. It's just a tear in the back of the disc. And in that tear, there's a little bit of nuclear material that's herniated in there, causing all the pain. We're going to go find it and clean it out with a laser. Once we do that, the pain will go away. Until we do it, he's going to keep having pain there. I got it. Go ahead and get everything else ready. We're in, Dr. B. Thank you. I'll take a blue towel, Luis. Any questions from our audience?
No current questions, but we do have a comment from Masadek on YouTube. And they said, "Sir, I am from Bangladesh."
Very nice. Thank you for sharing. Well, would you mind showing our audience the video of how is it that a herniated disc can actually cause so much back pain? Because a lot of people don't understand the mechanism by which a herniated disc does that.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. All right, so we've got the laser, the endoscope. You can see the tube. That's the metal thing. It looks like a metal, almost like an oval shape at the end. The blue stuff is actually nucleus pulposus that's degenerated. And it's so degenerated because of the inflammation going on within the disc. You can see the end plate right there. That's the surface of the bone or the vertebral body. We call it the end plate. It's what connects to the disc. And it's very pink, indicating inflammation. But the cartilage is also gone. There's almost no cartilage left there.
We have a question.
Sure.
This comes from Wanda Jones on Facebook.
Hi, Wanda. Thanks for asking. Welcome to our broadcast.
She asked, if what's causing the pain is the herniated material inside of the annular tear,
Yes.
why couldn't you take out all of the nucleus pulposus when doing the surgery and let the tear heal up? Then there wouldn't be any chance of a reherniation.
Oh, Wanda, I love it. Now you're thinking ahead. That's the first time anyone has ever asked me that question. As a matter of fact, you are correct. If if what I'm saying is true, which I say all the time, you don't need the cushion there to have a normal functioning disc, you're correct. We could, but I've never done that. But it is a very good idea. That's how good ideas are born. Creative thinkers. And Wanda has given us something to think about. Of course, I would never do that in this case because I didn't get the patient's permission to do it, but it certainly is something to think about. Here's a piece of herniation right here stuck in the tear. So Wanda's correct. If we go in and we remove the herniated material, clean up the tear, get rid of the source of pain, and then, of course, while we're here, get rid of the rest of the disc, then the nucleus, then there wouldn't be a recurrent disc herniation. Wanda, I'm going to tell you something. I like the way you're thinking, but I'm going to tell you something. Rather than trying to get all the disc material out, why not just have the patient have a lifting restriction and a bending restriction for a year and let this disc heal itself? And then we won't have a recurrent herniation either. The recurrent herniation rate here is 1%. That means that 1 out of every 100 patients will re-herniate after this surgery. And I can tell you something, every single time in my experience there's a herniation, it's been because the patient is not following my instructions. Okay? So why not just follow the instructions, and then we don't have to take out all the nucleus pulposus. We just let the disc heal. I personally think that's a little bit better option. This is the more painful part of the disc. Doing great. Just hang in there. Just about done. There is one good thing about these degenerated discs. They don't really take a long time to repair, whereas the juicier discs do. Not much disc left there, huh? Quite a bit of bone spurs. Just about done. This is that painful part right here. He's not happy right now, and I'm cleaning it out. Are we getting him a little deeper?
Yeah, I'm trying. He's got sleep apnea.
Uh-huh. Understood. You just do your best. I understand. I will tell you, as somebody who's had the laser dig into my flesh, it doesn't feel good. It hurts. Grab her. You can actually feel the irrigation coming out turn warm. That's how much heat the laser can produce. And of course we use cold irrigation to cool off the tissues, keep them from undergoing any kind of thermal injury during the procedure. I need 15 seconds, maybe 30 seconds left here. All right.
What's the best food to have
I
during
think we're done here. Huh?
What are the best foods to have during a hurricane?
Best food?
Just can't, unless you have power.
Mexican food.
Mexican, Puerto Rican food.
Yeah.
What's the best food to have when you're not in a hurricane? Mexican food.
Yes, always. Probably like what, grillable things?
Huh?
Stuff that you can throw on a grill?
Lights on, please.
Protein.
Come off.
Scope off? I don't know. We're done here at 5-1. You know, Mexican food. That's cold pizza and Mexican food.
You know, today was the first day in my illustrious tenure of working here that I had pizza for lunch.
What?
Never had the pizza for lunch.
No.
Yeah,
You're kidding me.
I'm not.
Why did you break down and eat pizza?
Because I forgot my lunch at home.
Ah,
The only part of the pizza I ever eat is the pepperoncinis.
really?
Yeah. And today I had pizza.
You had a piece of pizza.
Yep.
Can I ask if it was cheese or?
It was cheese.
I knew it.
And it was lovely. But I was so hungry. I'm like, I don't have food, so I'll have pizza.
We had pepperoni with extra cheese, and I honestly couldn't even tell it had extra cheese. Papa John's has gotten so damn bad. Papa John's, I don't know, have you heard? He's gotten on television, he said, the people that run Papa John's have ruined it. I honestly believe that. I've been eating Papa John's for a long time. It used to be really good. They used
You should try Marcos.
Yeah, I was about to say that.
Why don't you try Marcos sometime?
Marcos is really good.
They have a lot of good specials.
Marcos.
In their gas station, I think.
Why don't we try Marcos?
Marcos, let's get you right down the street.
I do like Bizarros.
I've never had
Oh,
it.
that's a gas station.
There's one I know beachside that looks really cute.
No, no, you can come in.
Lay still, you're doing great. All right, we're finished with L5-S1. We're going to go do L4-5 next. Got to bring the x-ray machine back in. And I'm going to have Luis put a little pressure here. Hold up. Yep. Any questions from the audience?
No current questions.
All right, folks, let's show you what the Deuk laser disc repair actually does.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, we are on our way to fixing the next disc, which is the L4-5 from the left approach shot. Want to keep an eye on our guide wire, make sure it's not moving. Doing all right, Doc? Shot? All right, we're going to be entering the neuroforamen right about now and slipping underneath the nerve roots right up to the back of the disc, right there. You talking to me? Shot? So we're right up against the back of the, you can see the giant tear. Yeah, the Soma, why do we give Soma? We really shouldn't give Soma. No, he's sleepy. I saw him. We can't, yeah, we can't do Soma. That should be really held for very, very rare cases. We never use Soma. We just started using it recently. And now we have a very sleepy patient.
Did we give them Dilaudid too or no?
It's the first of many, trust me. And I don't want to start having sleepy patients. Yeah, I wouldn't use Soma.
Go back to the Romax.
Just stick with the Robaxin. That's why I use it. It works. All right, we are in the L4-5 disc.
You did better than this one.
No, I would keep Soma for somebody who's a bit anxious and is having muscle spasms. Listen, I hear you. Hey, you know what they used to do for anesthesia? Alcohol,
Good?
ethanol.
How about a bullet?
And you know what? It works great in most people, but every once in a while, it shuts down the brainstem completely. AKA, it doesn't have a safety profile that's very reliable and reproducible. Soma is fine if you want to sleep. That's what I've always noticed about Soma, is it makes you sleepy.
That one Soma knocked him out. Out of
Yeah,
one dose.
she said he got up, got dressed, and he had to lay back down because they still too hard.
Endo, Crystal, please, on the roof, the city. Thank you.
All right. Are we back?
Yeah, we've been back.
Excellent. All right, we're going to be fixing the L4-5 now. We've already done the L5-S1. And you can see already some of the herniated disc in the tube. Any questions from our audience?
No current questions.
This will be our last surgery for the day and the last surgery for the week. So get your questions in. The blue thing, by the way, is the laser fiber. The blue is actually a plastic coating around the laser fiber. The laser fiber really is the glass tube in the middle. You can kind of see just the end of it there. And what it does is it takes laser energy from a machine and transports it about 6 feet. It's a 6-foot fiber, right?
Yes. Yeah.
So 6 feet transports it from a port where the laser generates the energy and releases it to the world, and it channels it through this little glass fiber. And it basically bounces off the inner walls of the glass fiber until it reaches the end, the tip, which is right there. You can see the tip right at the end, and then it delivers that energy in a pulse of energy. And it's so powerful, it makes everything jiggle. I heard they're remaking Constantine, or giving a new Constantine movie.
Yeah,
Yeah?
they're working on it.
Anybody know the original Constantine?
Well,
Keanu Reeves.
Yeah.
Fantastic movie.
Good movie, good movie.
What was that about?
Yeah, it's an interesting movie. You should watch it. It's pretty good. His job is to basically take demons and send them back to hell. Yeah. Yeah. No, no. It's glam scary. It's Keanu Reeves. I mean, how scary could it be?
It's based off of the anti-superhero from DC Comics.
There you go. Every time I see it, I think, just use the Matrix power. Come on. But I think the ending is the best. That's really, I think, the best part of the movie. It is on Netflix. Yeah.
It may not be anymore. I think it's on HBO.
I saw it on Netflix.
Oh, then they probably switched it. You're right.
But I don't know if they're rotating it out this week or what. But, you know, hey, you don't have to come to work Thursday.
You gotta watch Fauda.
Which one?
Fauda, F-A-U-D-A, Fauda. It's about, it basically means chaos in
Huh.
Really, really good.
Really? What's it about?
It's about an Israeli police force defense.
Fauda?
Yeah, and it's about the lives of a group of people that are in the defense, Israeli defense.
I think you told me about this.
Really good.
And that's on Netflix? Yeah, please do. Fauda.
How do you spell that? F-A-D-A?
F-A- F-A-U-D-A.
F-A-U-D-A. Okay.
Well, we're all going to have some time to watch Netflix.
If we have power.
Yeah.
On the phone. Download Netflix on your phone.
I watched Dahmer. I watched the... Oh, look at the inflammatory tissue, the pink stuff.
What? Which one? Which one?
Does it just go over every single person he killed?
El generator is for the generator.
I don't think they know. Well, wasn't it in Wisconsin?
I watched up to the two police officers came over and I just let him go. The kid had literally drilled with the skull base. He put it. Yeah. I was like, wow. How are those police not seeing the blood?
Yeah.
I think those police officers got fired. Are you serious? So they basically killed that kid. The assistant. He was only 14 years old.
So you think that that's historically accurate, that series?
Oh yeah, it's very accurate. It's very accurate.
Huh.
It's really accurate. Because I remember them talking about the 14-year-old guy at the end. Police officer couldn't save him.
I kind of like how they go into his childhood to try to explain his craziness.
His father was a little weird. Yeah, his father was super weird. I texted my older son and said, "You be glad you got a cool father and not a guy like that." With my son watching.
Oh, really? We're talking about the Dahmer miniseries. Jeffrey Dahmer. Wait. You telling me Texas Chainsaw Massacre really happened?
I didn't even know that.
Yeah, that's totally.
That's insane.
I mean, well, the movie might have been drummed up a little bit. Yeah, that definitely happened.
Yeah. Anybody ever see the movie Motel Hell? That's an old one, 1980s. Motel Hell. If you like horror, you gotta watch that, man. These new horror movies, I just laugh at them. None of them compare to the old stuff.
You have about 5 minutes left?
5 minutes, yeah.
It's worse than American Horror Story, I think. They said Dahmer was the #1 movie on Netflix. #1 series, yeah.
I don't see it. It's not ever gonna get close to Witcher or Squid Games.
Good games for Dahmer. Have you guys watched Handmaid's Tale?
Which one?
Handmaid's Tale?
Handmaid's Tale? No.
Gotta watch that.
Is it good?
I've heard.
Huh, Henry?
No, I was saying I've heard so much about that show, and I just never got around to watch it. But I want to. Yeah.
You ever see the movie?
Stop watching it, you can't stop.
Is it a series?
Yeah.
You ever see the movie The Village?
Yes.
That was pretty cool, wasn't it? That's an old one.
Anything with M. Night Shyamalan, I'm just like, it's gonna be it's gonna be a ride. There's a new movie that they just released a trailer for. I forgot the name of it, but it's with the guy, the WWE star Batista, Dave Batista.
Yeah.
Yeah. Oh my God. It's, I think it's about this this family of three that come out into the village, go out into a cabin, and they have their adopted daughter just roaming around, and then she gets stumbled upon by these four people who I would assume they claim themselves as like the Four Horsemen, have to prepare for the apocalypse. It's like messed up. But I don't know.
Huh.
Yeah, it's kind of wild.
What's it called, Henry?
I am looking it up right now. I forgot the name at the moment.
Handmaid's Tale. That girl, that actress with no stars in it, she's so good.
Huh.
Her acting.
What's it about, this Handmaid's?
It's hard to describe it. It's post-apocalyptic dystopian society where it's where the United States is divided into two, and they're against Canada.
Really?
And basically, I don't want to say too much about it, but because of there were some issues regarding the nuclear war, and many of the women, for some reason, in the wealthy class, were unable to bear children. But lower class women were able to bear children and were not affected by the war.
Huh.
So, what's that? I don't know, but it basically goes on the life of a woman who is classified as a handmaid. And she's a maid that basically does everything in the house, includes bear the children for the owner.
Mm.
Now I gotta watch it.
Well, you gotta see what goes on.
Yeah.
It's just,
I think you got me hooked right there.
2 minutes, 2 minutes.
how they film it is so dystopian. I like the colors of it and stuff, and how it's like always there's a blue-green all the time going on.
No, that's why you gotta watch The Village. You never seen The Village?
It's crazy.
Uh, 30 seconds. I think we're pretty much done here.
Found it. Knock at the Cabin. That's the new M. Night Shyamalan movie. It's weird. I'll send you the trailer. It's amazing.
Nice on, please.
Nerve roots up there and all that fat. We're done.
Scope off.
All right, listen, write up your questions for me and I'll come answer them for you face to face. Scope off. But we're done. And everything went really well for him. He slept beautifully. Dr. Berndes has done a remarkable job. Always difficult with sleep apnea patients. You're just waking up. Everything's good.
You're all done.
Relax. You're doing great. Just lay still. We're almost done. You're okay. We're good. I need the...
Jordan, you can help me with the camera. Thank you.
All right, folks. We're done. He did really well.
Need
Lay still. You're good.
oh, it's
We're all done. Got it.
what is it?
We fixed 2 discs. We did the L4-5 from his left and we did the L5-S1 from the right. Can you see this, Henry? That's where the incision was for the first one.
Yes, we can see it.
You just compare it there. It's tiny. The whole surgery was done through this little tube here. And a lot of people are told they need fusions, but they really don't. Let's go ahead and show the difference between a fusion and a Deuk laser disc repair.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before release to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, A spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's half-inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
It's Dr. Arjugmajan at the Deuk Spine Institute here in Florida with one of my patients who had the Deuk laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How are you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well,
and I came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
Amen.
Yeah, and I'm A1 now.
Awesome. So you had your surgery. You've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too. When you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is
Not too soon with any of that lifting engines
All right,
and
all right,
contorting
all
your
right, all
body.
right, yeah, all right. But I have, all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and I got, well, that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back. But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well,
Yeah.
congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
You're
God
welcome,
bless.
sir. God bless you. All right, I'm here with one of my patients who traveled from Australia to Florida to the Deuk Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone
Awesome.
from the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Deuk laser disc repair.
I had the Deuk laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Deuk laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Deuk. I found Dr. Deuk, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not only about you. It's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Deuk Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system people like, the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing. And your staff is really cool. I
Thank
should
you.
say, yeah, they're welcoming. They're good.
Thank you very much.
And you are the best. I should
I
say.
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
If you are suffering from back pain, this is like a very good cutting edge technology and very advanced surgery, which Dr. Deuk has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it.
We're cutting in 3, 2, 1.
Yes, welcome to the finale of our broadcast for the last surgery of the day, which we've just completed. This patient has had 40 years of lower back pain, bumped around from doctor to doctor, provider to provider. Nothing has worked. He's been in pain for 40 years. Why? He has 2 damaged discs, one at L5-S1, one at L4-5. The L4-5 is an annular tear with a disc bulge. Most doctors would have just passed it over and not treated it, but it was definitely causing his pain. The L5-S1 was even worse. It was a degenerated collapsed disc. You could see it on the MRI, and we went in and basically repaired both discs. We did it in under an hour. The patient will recover for an hour and then go home. This surgery will change his life. He won't have the back pain anymore. I expect that to be gone. He may have some other type of pain from some other muscle or joint, which we'll deal with if we need to, but the pain he came to us with from his disc will be gone from this day forward, as long as he doesn't re-injure his back. Why are we able to do this for people? We're able to do it because we know where the pain comes from. It comes from a tear in the back of the disc, and we discovered that here at Deuk Spine Institute 16 years ago. And we've been doing these procedures now for 16 years. We average about 100 patients a year, and we've done now over 1,500 surgeries and counting. We have people that come from all over the world to have this surgery done, right here to Deuk Spine Institute in Melbourne, Florida. Do we have any questions?
No questions, but we do have a few comments.
Sure.
And this first one comes from Tony Maurice on YouTube. And he said, Dr. Deuk, I am skeptical and terrified to have more surgery, especially with this barricade device. I don't think I can be fixed.
Yeah, unfortunately, one of our viewers had a barricade device put in, which did not work, obviously. And unfortunately, he's struggling with the idea of getting fixed. So I feel for you. I wish you best of luck, whatever you decide to do.
And the next one comes from Masadek on YouTube. And
Hello, Masadek.
And he said, Sir, it's been a month since I underwent lumbar pedicle screw operation. There is no pain in the back, but there is numbness near the left foot. Please help me.
So this person said they had a fusion done with pedicle screws, and they don't have any back pain anymore, which is the fusion has stopped, but he's having numbness in his foot. It was a month ago, is my understanding, your surgery. You know, it can take 6 months to a year for the numbness to go away. I wouldn't give up yet. I think there's a very good chance that the numbness will improve. I don't know who did your surgery or where it was done, but whenever I do my fusions with pedicle screws, I always do a decompression so I get the pressure off the nerve. That way I know we've done everything that can be done to unpinch the nerve for the patient. Therefore, they have the best chance of the nerve healing. I've never had a patient where the numbness didn't go away eventually. I just don't know who did your surgery and what they did for you. Hopefully the numbness will go away. If a year goes by and you still have numbness, then maybe the nerve is still pinched and you should get a new MRI scan done.
And the next question comes from Juan Salinas on YouTube. And they asked, do you take private insurance, Blue Cross Blue Shield, from Bakersfield, California?
Hello, Mr. Juan Salinas. Do we take Blue Cross Blue Shield? Absolutely. We take virtually all insurances. However, that doesn't mean the insurance will pay for your treatment. It really depends on what treatment you're getting done and what insurance plan you have. If you're talking about the laser surgery that we're doing, we've had some good luck with Blue Cross Blue Shield. We've had some plans that have paid. We just don't know whether your plan will pay. Every patient has to pay a deposit up front before they get the surgery done. How much that deposit is depends on what levels are being treated, how many discs, how many sides, and that's something that we'd have to do a free MRI review ahead of time and determine whether or not you're a candidate for the laser surgery, how many discs need to be repaired, and how many sides need to be repaired. Once we've determined that, we can give you the pricing, and there will be, again, a deposit paid up front. We balance bill the insurance for the rest.
And that is it.
All right, well, I've enjoyed our time together today. We've done 4 surgeries, 2 cervical and 2 lumbar. All the patients have done very well. I just saw the 3rd patient. He's getting ready to go home. We were talking about first-person shooter video games. He's a video game developer, and I'm a video game player. And so thanks for joining us. It's been great questions and great comments today, and I hope you all have a safe and enjoyable